Hi, everybody. Thank you for joining us today. My name is Sadena Thevarajah, and I'm Managing Director here at HealthBegins. I just have a couple of housekeeping announcements today. First of all, thank you for joining us on this webinar on From Hollywood to Health Equity, Narratives with Impact. Before we start, we want you to know that this webinar will be recorded, and we'll be sending the recording out at the end of the session. All participant lines are on mute, but we do encourage you to ask questions. So if you go to your GoToWebinar doc, you'll be able to see a place where you can input questions at any point during the session, and we've reserved time at the end to be able to address them. And the presentation is scheduled to last just under an hour. So with that, I would like to introduce Kate Folb over here, my co-presenter.
Hi, everyone.
And so, Kate, why don't you just say a little bit about yourself?
Oh, gosh, that's the worst part. Hi, everybody. I'm Kate Folb. I'm director of Hollywood Health and Society, which is a program of, and you get a prize if you can repeat this, the USC Annenberg School for Communication and Journalism Norman Lear Center. And then add Hollywood Health and Society to the end of that. That's my entire project. But we just call it HH&S. So I've been director of this project for about 7 years now, and I've worked in this field for over 25 years. I could go even further, but 25 is enough. So I'm really happy to join you here today, and I look forward to this presentation.
Thank you so much for joining us. So I did want to say a little bit about you. Yeah, so you've worked over 20 years in the entertainment education field. I have that you've worked at top TV shows and films on issues of alcohol, substance abuse. You've addressed portrayals of adolescent reproductive health in the media, and you've led your own entertainment education consulting firm. And so we're excited that you're here today to share the work that you've been doing with Hollywood Health and Society.
Thank you.
So thank you for joining us. With that, we will switch over to our slide deck. And so I just want to give a couple of framing remarks before I hand this over to Kate here. So one thing I wanted to say is that a little bit about myself. I'm a lawyer by training. We will be talking a little bit about contracts at the end of this session, but nothing I say will constitute legal advice. So take that with a grain of salt. And at the end of this webinar, we hope that you'll be able to explain how stories about health equity can be brought to the mainstream. We're going to talk about ways to measure the impact of a well-told story in certain media, and Kate's going to help us with that part, especially. How to make the case for the importance of diverse narratives in health education, in training, in events, pretty much in every environment that you could find yourself in. And then, of course, how to craft your own inclusion statement for contracts and projects within healthcare, which is what we've started doing here at HealthBegins. One question that we've been asked is, why are we talking about this today? If you're familiar with our work at HealthBegins, you might be wondering why we're going into Hollywood space. Of course, we are located in Los Angeles, so we do like to make note of that and enjoy our territory. But I think it really comes down to 3 reasons. One is because of who we are at HealthBegins. It really aligns with our mission. 2 is because of the moment that we're finding ourselves in. And 3 is because of the inherent power of a well-told story and bringing those 2 components together. So just a little bit about HealthBegins. Our vision here at HealthBegins is for a just system that treats both medical and social conditions to allow people to live their healthiest lives. On top of that, we have 3 core values that we live by. One is in growth. That means we continuously learn, develop, and excel in all that we do. One is regarding joy. We nourish joy and well-being in all of our relationships and communities, both professional and personal. And equity. We apply our strengths with humility to serve, partner, and promote justice for all people. And especially this equity component comes up for us routinely in the clients that we engage with the work that we decide to do, and is the driving force for why we've decided to put inclusion writers within our own contracts. A little bit about the moment that we're in. So what triggered this for us was Frances McDormand's speech at the Oscars this year in early March, when she ended her Best Actress Oscar acceptance speech with 2 words, inclusion writer. And that made us think, yeah, that's something we should be doing too. This isn't just for Hollywood, but this is built on many social movements that have been taking place over the years. So we also have the Me Too movement started by Tarana Burke in 2006. We have April Reign's Oscar So White movement in 2017. Of course, Black Lives Matter that have been around for many years, and Time's Up that has generated more attention this year. And so this is kind of the moment and the space that we're in, and that's given us reason to look at our own contracts and look at how we can better position ourselves to be advocates for equity in not just what we advise our clients to do, but also in how we live and work. So Kate, I'm going to hand it over to you just as I wrap this part up. But the last component of why we're talking about this is just the inherent power of story, and it's something that everyone here at HealthBegins has used in our own work. And the power of story is why USC's Hollywood Health and Society program has spent nearly 2 decades educating screenwriters and producers about real facts and critical issues in health. So by placing compelling stories and social determinants of health in the public eye, you've been getting health equity the attention that it deserves. And so after Kate shares her part, I'll come back on because healthcare has something to learn from Hollywood too, and that's when we'll talk about inclusion in the spaces that we occupy. But for now, do you want to take it away, Kate?
Great. Okay. What do I do? This one. Right? Okay. Hi, everybody. So there's the title again, just in case you forgot. It's the USC Annenberg Norman Lear Center Hollywood Health and Society project. We're part of the University of Southern California Annenberg School for Communication and Journalism. Although we're not located on campus in this beautiful building, much to my chagrin, but we are in a beautiful building in the heart of the entertainment industry in Beverly Hills, so it's not so bad. So before I get started, I just thought I'd play you a clip to kind of give you an example of the kind of work that we do. So I'm going to let Sadena play that. You may be familiar with this show, Blackish, which is a hit comedy on ABC. And this is a clip just to sort of exemplify the kind of work we do. Let me see. I might have to go to. There we go.
Oh, it's not
Audio.
Sorry. Sorry, 1 second.
Okay, well, I'll talk while you're doing that.
Okay, thanks.
Part of what Hollywood Health and Society does, or I should say the Norman Lear Center does, is we study and shape the impact of entertainment media on society. So we're looking at the impact that entertainment, television, and film to some degree have on audiences' knowledge, attitudes, and even their behaviors around their health. Let's see if we're going to go now. So we look at the impact and we also help shape that impact. Okay, are we going?
Hey, I don't want you to freak out. Don't freak out. Pobbs has a clogged artery. Don't freak out. And they think, don't freak out, that he needs a very simple and routine angioplasty. Don't freak out. It's okay. Don't freak out.
My old decrepit Pops is gonna die. Ooh, good morning, everybody.
Good morning, baby boy.
What you doing with my suitcase?
Moving you out of the guest house into one of our spare bedrooms so we can keep an eye on you while you recuperate.
Well, I don't need to recuperate. I'm not having any operation.
What?
I got a second opinion. and I'm fine.
Angioplasty?
Yeah.
Man, no. You walked up here, didn't you?
On my own 2 feet.
Oh, you good.
If it feels real bad, use a little Afrin. That helps.
Been doing that every day.
Got some liniment in the trunk for $5. Also got bath towels, 2 for $8.
Liniments? Afrin? You guys are crazy. Cranberry juice cleanses the blood.
So I'm good.
Cranberry juice is for urinary tract infection. It's not gonna help your heart.
And that's some very pale cranberry juice.
It's because it's mostly gin.
What?
What's your favorite pizza? Most memorable topping? Where were you when you first tasted Chicago deep dish?
Chicago, idiot.
I will always cherish this.
You know what I like on my pizza? Potatoes!
That's funny. I just bought a fresh sack of them. Come on. Get your potatoes here. Fresh hot potatoes.
Hey, what's
Everything
going on?
okay? What happened?
Everything's fine. Okay. Everything's fine. I'll have the damn operation, but not because of you. I'll let one of them quacks cut me open.
Oh, they actually don't cut you open. They just make a little small incision in your groin, and then they have a metal tube that they feed all the way up.
He said he'll have
He's gonna
it.
okay,
Yeah.
you already said yes. So I'm just gonna stop talking, and I'm gonna book it.
Stop talking. Stop. Okay. I mean, you know what can go wrong? It's just a simple balloon angioplasty. Oh, my daddy's dead. My daddy's dead, and I didn't get a chance to tell him I loved him. Now it's too late. Damn, James.
Excuse me? Mr. Johnson?
Yes, doctor.
Your father's procedure's finished, and he's doing great.
Thank you, doctor. He's alive, despite the odds. Okay.
Okay, great. So that's just an example of the kind of work that we support and help do. I'll tell you just right off the bat, we are definitely not master storytellers, nor are we master comedy writers. We're there to support television writers and producers with the storylines that they want to tell. But Blackish is a great example of looking at stories of people that maybe haven't been told over the years and getting those out there. That particular episode obviously was about African-American men who don't like to go to the doctor and refuse to go, and also the fact that they have a higher percentage of heart disease and other issues related to stroke and other things. And so it was a great opportunity to tell that story in a comedic way and also to raise awareness of the issues. So anyway, back to what we do. So we study and shape the impact of entertainment media on society. Oh, it's not changing for me. Hang on. There we go. These are just some of our partners. Over the years, we've been funded by the Centers for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and others. We have a formal partnership with the Writers Guild, which is the union that supports television and screenwriters. And we have a formal partnership with the Television Academy. So these are, and very informal partnerships with the Producers Guild and Women in Film and other groups that support the entertainment industry. So Hollywood Health and Society, my project, provides entertainment content creators with information and access to experts on a wide range of topics beyond health, from health and medicine to safety, security, policy, law, and much more these days. Because we've been doing this since 2001, writers know to call us for any of their needs in terms of what they're doing, the research that they're doing for a character or a storyline. And so they'll call us even for the most random topics that maybe don't fall under our purview, but because we've been doing this so long, we help them anyway. I had a writer call me and say, okay, this might be outside of what you normally do, but we have a Buddhist character. Can you help me just understand Buddhism a little bit more? And so, of course, I had a Buddhist monk in my database, and we called him up and we took care of it. So we're really available to help writers with any topic that they're interested in writing about. For an example, from 2012 to 2017, we consulted on over 1,000 aired storylines, which those aired storylines spanned hundreds of TV shows across dozens of networks and cable and streaming channels. These are just a few of them. We also work with Spanish television. You can see the logo for Univision and Telemundo there as well. So what is it we actually do? Well, this is a list of our services. We provide what we call briefings and consultations on demand. So we're kind of like, and those of you who are over a certain age will get my joke here when I say we have operators standing by to take writers' calls. Usually it's emails now, but we have sort of a call center where writers can call us or email us with quick questions that they need for their storylines on anything to do with health, safety, security, and law, and so forth. So they may just call with a quick question, like, I have a character who the doctor is going to diagnose them with leukemia. What's the language that the doctor would use? How would they, what would the setting be like? And we can either get that information for them from our experts, and I have in my database probably 2,000 experts that are willing to consult with shows and to work with us pro bono in the interest of health information out through the entertainment airwaves. So I can go to them and get that information for the writers, or I can put that expert on the phone with the writer if they want to have a deeper conversation about the issue. Or I can even bring those experts into the writer's room so we can sit down with the entire writing staff and do a very deep dive into a subject that they're interested in writing about. All of that is on demand. They can call us with a quick question, or, hey, we really want to talk to an expert in genomics or something, and we can bring that person in and do a deep dive. We also sometimes get calls from the set. Where the set designer will call us and say, what does a genomics lab look like? Does it have beakers or does it have computers? Like, what does it look like? And we can help with that as well. And all of this is in the interest of providing accurate information to the viewing public on health and safety and so forth. So that's our sort of on-demand services. Then we also do additional outreach. We hold panel discussions. We do where we bring in experts and also what we call real people storytellers, which are, just real people that have a personal story to tell, maybe a challenge that they're facing that relates to the topic we're talking about. And they can share their personal stories with writers. Writers love to hear stories about real people because they're writing about fictional people, but are based on real characters as well. And we also do what I love is our on-location trips, where we'll pile writers into a bus and take them, for example, down to South Central LA. We took a bunch of writers to South Central LA, dropped them off on a corner, gave them each $10 and said, okay, in walking distance, figure out how you're going to feed your family of 4 with that $10 when there's a liquor store and a 7-Eleven. How do you do that? So we like to immerse them in those experiences so they can understand what it's like to live in a food desert or a food swamp or have limited resources and choices that you have to make. On the photo on the upper left-hand corner, that's a group of writers we took to NASA JPL to learn about climate change and to talk to the scientists behind the scenes about what they were doing and how they were looking at the earth and what they were preparing to do. So all kinds of different trips that we can take writers on to really immerse them into the realities of being a human on this planet. We also have a website and we do tip sheets and excuse me, we have a reel-to-reel newsletter, which is just stories, again, of real people that they can read about and hopefully be inspired by. And we support networks in doing public service announcements on various topics. And also we support the shows with transmedia, which I'll get into a little bit more deeply later. Because now nobody just watches a show. They go to this Facebook page, they're tweeting about it, they're having conversations with Twitter conversations, but also just texting each other about what's going on in the show. And so we can support the show with additional resources that we can give to the audience that relates to the topic that we're dealing with on the episode. And then we also do research and evaluation to look at the impact that these shows and storylines have on audiences, knowledge, attitudes, and even their own behaviors around their health. So here's an example. In 2014, we held a panel at the Writers Guild, WGAW stands for the Writers Guild of America West, on healthcare coverage. And it was not long after the Affordable Care Act had become a law, and we wanted to really help dispel the myths around death panels and all the crazy talk about the Affordable Care Act, and also to have writers understand what the Affordable Care Act is covering, but also who's still not covered, or people that are still facing challenges about accessing health care. So the woman in the upper left-hand corner is Zoanne Clack, and she's actually an MD herself, but she's the executive producer of Grey's Anatomy. Both of those ladies in pink actually write for Grey's Anatomy. And you can see we broke people out into small groups, and we had them sit with experts on the topic of health coverage, but also with advocates, and also, quote unquote, are real people who have stories to tell about their own challenges in accessing health care and health coverage. And a number of people in the room were undocumented immigrants who told their personal stories about the challenges they faced. And so you can see them furiously taking notes there as they were hearing from the experts and from the real people. And then a few months later, an episode aired on Grey's Anatomy that had to do with an undocumented mother and child that were seeking health care through the ER. And it's a very compelling story. It's called Only Mama Knows, if you want to look up the episode, but it has to do with a woman whose child is very sick, and she drops her at the ER and leaves her there because she's afraid that if the mother is caught, she'll be deported. They'll both be deported back to their own country, where things can be a lot worse. So so it was a wonderful storyline that then just sort of reflected what our writers and producers had learned in that briefing that we held, or in that panel discussion. And just so you know, I mean, that episode, I think, reached about 11 million people in the US, but Grey's Anatomy is also aired in over 200 markets around the world, 60 language. It's translated into 60 languages, and they just got renewed for a 15th season. So it will be on the air, more to come. But this is an example of the kind of work that we do in order to include important health information and stories of disenfranchised individuals to the general viewing public, so that they can A, feel included, part of the inclusion piece, and B, access important information. And we've learned through our research that viewers actually do act upon and learn from their popular television shows that they watch. They bring those people on the shows into their homes every night or once a week, and they feel like they're family in some ways. And they really do believe and learn from what is presented in these shows.
I have a question for you, Kate,
Sure.
because our audience, a lot of them are upstreamists. These are people who are working with, for example, in the Grey's Anatomy space, people that are undocumented, that are facing legal issues that might not be forthcoming within clinical environments because of fear of deportation or other adverse events. So do you see a place for the folks that are a part of HealthBegins orbit, like these people that are experiencing these stories firsthand within the work that you do?
Oh, totally. Well, one way would be anybody out there who wants to serve as an expert for us and is willing to talk to television writers, to sort of share your experiences and stories that stories of your clients or people that you see. That's all golden for television writers. And the more we have those stories to share with writers, the more we're going to see those stories show up in the episodes and in the storylines. And again, when you have a show that reaches 11 million people, and that's across the board, that's not just 11 million white people. This is 11 million people across demographics in the United States. And other shows have other demographics, of course. But that's helping to normalize those experiences so that they will be less hesitant to come forward. They'll feel like, oh, that's me. That's an example of an experience I had. And so it will, A, help normalize it for people who may be facing those same challenges, but also help normalize it for people in the careers that are listening here today. People in, as I say, the more voices heard, the more stories told, the more we understand each other, and the more we'll be less afraid to come forward with some of those things. So that's again, our mission really is to help bring to the general public these important stories around health and safety so people can learn from them and also see themselves reflected in them. So just a nice segue here. This was another panel we did in New York it actually was on women's health, 3 different topics around women's health, but one had to do with breast cancer, particularly among African-American women. And the woman who's standing in the front of the panel there is a breast cancer survivor who was telling her story about how she didn't even get screened for breast cancer until it was very late stage because she thought breast cancer was a white woman's disease. She had never seen a person that looked like her reflected on television in the news or on narrative entertainment TV around a breast cancer story. So she just thought it was something that plagued white women only. And so luckily she's a survivor and now she's an advocate and goes out and talks about this within her own community, that breast cancer is something that African-American women need to be aware of and be screened for just as commonly as any other woman on the planet. So the man there in the lower left-hand corner and who's sitting on the panel is Beau Willimon. He's the executive producer of the Netflix show House of Cards. And he was on the panel to talk about a sexual assault storyline that he had done on his show. But you can see him listening to her. And lo and behold, the next season of House of Cards, the first 2 episodes had to do with a storyline about African-American women and breast cancer. And I happen to be sort of binging the show and also doing 12 other things probably. And I heard out of I wasn't watching the screen, but I heard a line out of the show say, did you realize that African-American women are 60% more likely to die of breast cancer than white women? Mm-hmm. And I thought, my ears perked up and I thought, oh, that's right out of our panel discussion. So I emailed Beau and he said, yes, absolutely, that he wished he could have done even a deeper storyline and he was so moved by that issue. So again, that's a way that we can impart this information to the master storytellers who can then impart it to millions of viewers across the country and across the world. These shows are not just limited to the US anymore, especially with things like Netflix. So impact, I just want to share a little bit about how these shows do impact our audiences. And we have another clip coming up, so I'm going to let Sadena take over and figure out how to play this, and I'll explain the setup. So there's a show called How to Get Away with Murder, which is hugely popular on ABC. And before you hit play, just tell me, because I'll set it up. It has to do with students in law school, and anyway, it's a very soapy Shonda Rhimes kind of show. But they came to us because they were doing a storyline on HIV. There are 2 guys in the show who wanted to take their relationship to the next level. One guy is quite the player and had been around the block 2 or 3 or 4 times, where the other guy is very goody-goody and not so much. And the goody-goody insists that they go to get tested for HIV before they take their relationship to the next level. So in this scene, you're going to see Connor, who's the player, who's a little nervous about getting tested for HIV because he knows how his behavior has been.
How many sexual partners have you had in the last year? An estimate's fine.
20?
So less than 2 a month?
Probably.
So I don't know how many of you have seen How to Get Away with Murder, but I'm going to give you a spoiler if you haven't. So the 2 guys go and get tested. You're going to see Connor's experience getting tested. Let's see if you can hear it now.
How many sexual partners have you had in the last year? An estimate's fine.
20?
So less than 2 a month?
Probably more like 30.
Okay. Well, I'm not sure if we're going to get the audio for this one, but I'll explain it to you. So as I said, Connor is kind of a player. He and his boyfriend, Oliver, are going to get tested for HIV. This is Connor in the clip, who's a little nervous about getting tested because he's been rather promiscuous. It's kind of an amusing scene because the nurse is just very flat and asking him questions, but he's sort of lying his way through, and then she keeps looking at him, and then he comes clean and talks about the dozens of partners he's had. We're going to try one more time for audio, maybe.
Over.
Okay, hit play. Let's see.
How many sexual partners have you had in the last year? An estimate's fine.
20?
So less than 2 a month?
Probably more like 30. 40.
How often do you use a condom?
Always. Well, okay, I mean,
I think that clip cut off a little bit early, but at any rate, he's nervous. Obviously, you saw he's nervous about getting tested. So as I said earlier about transmedia, so we often work with shows on their social media as well. And How to Get Away with Murder is a show that young people not only watch, but are tweeting about it, are on the Facebook page, are texting each other about it. And so we're able to also be part of those conversations and offer resources and other information to the viewers that might help them if they're looking for a testing site near their area, or if they need to learn more about HIV infection or whatever. We can provide some of that information for them. But I wanted to share, and this is anecdotal impact, but it gives me cold chills every time. There's a guy, Francisco Ramirez, who you can see in the lower left corner, who actually follows our Twitter feed, and he's a health educator in New York. And he received a text from one of his clients or someone he knew. And I don't know if you can read it, but it says, thought you'd appreciate this. Last night's How to Get Away with Murder featured a story of a gay couple getting tested together, but it was very nerve-wracking. And it made me realize I'm probably due. So I went this morning, and he has in parentheses negative, but the nurse said I was the 5th guy to mention it. And by it, he means the show. 5th guy to mention the show, and they'd only been open an hour. So in 1 hour, 5 guys had walked into this one clinic in New York City and mentioned How to Get Away with Murder was the impetus for them to go get tested that day. That show reached 13 million people in the US. So when I imagine health clinics all over the US, people walking in to get tested, whether or not they mention the show, they may have been inspired to go get tested by watching this show. So again, this is kind of why I get up in the morning, and this is why we do what we do. Anecdotal, but still. And now next, we've got one more clip. So we're going to pray to the media gods that it'll work right this time, that I'll set this up. Well, let's see. So this is a show, Royal Pains. Actually, and if you can hold off for playing it for just a second.
Yeah.
So this is a show called Royal Pains, which is on the USA Network. Now, the USA Network, if you know, is the one that has Characters Welcome. That's their slogan. And they have lots of sort of feel-good shows. This is a medical show, sort of a feel-good medical show about a doctor who takes care of very wealthy patients in the Hamptons, but he also does pro bono work on the side. And so they came to us because they wanted to do a storyline around about a transgender young person. And mind you, the young woman who's playing this role is actually a transgender actress. So again, inclusion. This is including people to play the roles that they represent in real life. Mm-hmm. So anyway, they wanted to make sure they had the proper language and so on and so forth. And we thought this would be a great episode to study the impact of, because the USA Network is a very general network. It reaches Middle America. It reaches people of all different ideologies. If you're watching the show Transparent, which is a show on Amazon, which has to do with a transgender individual, you're probably already, you're ideologically in line with that. But if you watch USA Network, you may or may not have those same ideologies. So we thought this would be an interesting show to look at if this storyline would have an impact on people's attitudes around transgender people and policies. And this was the time when we were, everybody was arguing about bathrooms and who was going to use what bathroom, and all of that was going on. And this was before Caitlyn Jenner came out and before her story. So I'll show you a little bit of the clip, and then we'll talk some more.
Your shortness of breath could be a sign that clots have broken off and scattered to your lungs. And I have to ask, how long have you been a girl? Do your parents know that you're taking estrogen?
My mom tries to be supportive, but she insisted I see a therapist. And made me promise not to start hormones until I turned 17 and not to push for surgery yet.
But
A few months ago, I started taking estrogen behind her back.
self-administering?
It's just a pill.
Well, sometimes it's not that simple. We should run some tests. It sounds like you're having a really good day. I'm sorry to be the bearer of some not so good news. Your blood work came back. You have a condition called factor V Leiden deficiency. It's a clotting disorder, a tendency for the blood to form clots on its own. When combined with estrogen, it can be dangerous.
What if I keep taking blood thinners?
You will for a few months, but it won't cure your deficiency. Anna, I can't recommend you as a candidate for hormone replacement therapy.
Okay, so so that's just a little clip, and I'll tell you that it does. The show does have a happy ending. So I know the clip ends kind of on a sad note, but it does have a happy ending. But this is an example of where we can see how narrative storytelling really does have an impact on people's knowledge, attitudes, and even behaviors, depending on the topic. So so we did an empirical study on this this storyline. Since we knew it was coming down the pike, we surveyed audiences. We surveyed people that were regular Royal Pains viewers and also regular USA Network viewers on a number of issues, including transgender people and policies. And we found, and then we aired the episode, and then we did a post survey after the episode aired to look at their attitudes and if anything had shifted. And what we found was that the people who viewed the Royal Pains transgender storyline had more positive attitudes towards transgender people and more support for trans-friendly policies. And it also had a cumulative effect. So if they had seen this storyline plus other storylines that had to do with transgender people, of course, their attitudes were even more positive. We also, during the midst of our study, the Caitlyn Jenner story broke. And that was all over the news. So we had to sort of account for that in our study. But we found that the Caitlyn Jenner story in the news did nothing to move people's attitudes in a positive direction. If they had negative attitudes towards transgender people and policies, they stayed there, or they even dug in deeper when exposed to the Caitlyn Jenner storyline only, or the story in the news only. But by watching a narrative story about a person who's facing challenges, who has a life, who has a family, has, you know, you're transported into their story. Those are the kinds of things that helped move the needle in a more positive direction. So this study was published actually last summer in, I believe it was in Sex Roles. If anybody's interested in reading the study, I'm happy to send you a link to that. You can also find that information on our website. I know we're short on time, so I'm going to go really fast. There's no more clips.
I did have a question that came in, and this is related, I think, to what you showed with how to get away with murder with the transmedia component. And so there was a question about how can people in healthcare get involved in social media in a way that gets more important health equity stories into the stream?
Oh, that's an amazing question. Well, in terms of the way we work with social media, again, we're always interested in having people that are available to help provide resources or information to our writers and also via social media. Also, I would suggest, if you follow us, if you follow Hollywood Health and Society on our Facebook and our Twitter, and retweet some of the things that we're doing, especially around these issues that connect with a storyline that we've seen on TV. We'll do a lot of tweeting about it and posting ourselves, as well as linking to the show. And if you can get involved in retweeting that within your own circle of friends and colleagues, then it just gets that information out even further. It might spark somebody to then go and watch that show and learn more, and it becomes this big circle of influence. So I think that would be a great way. If we had more time, I have all kinds of other ideas. So we may have to do another webinar for that. But I'll just go very quickly through another storyline we did that spanned 8 episodes on the show 90210, had to do with the BRCA gene. This was before people knew about the BRCA gene. We surveyed viewers before the storyline aired and then after, and we found that, you can see by the chart, people who saw no episodes, about 30% of them knew about the breast cancer gene, but after just 4 episodes, that doubled. And again, in terms of actions, the first thing they did was learn to go and find out about their family history. And again, after just 4 episodes, we saw that number go up quite a bit. Lastly, we do an annual awards program where we honor shows that have helped to inform and inspire viewers and used accurate information. These are some of the winners of the 2017 awards. And then very lastly, we also do storytelling workshops with folks like you who are listening. So we bring Hollywood storytellers, established Hollywood writers and producers in to work with health experts, to learn about storytelling, to learn sort of how to tell a story, the way a story arc works, where you want to get your impact. And if you look at the photos in the upper left-hand corner, the woman that's got the boot on her foot is Jennifer Cecil. She was the executive producer of the show Private Practice. And she's working with a bunch of cancer health providers at the International Cancer Conference in that year. It was in Melbourne, Australia. So she's working with them on how to tell better stories. There are others, in some of the pictures we were in Mexico doing a similar thing, and also recently at USC Annenberg working with media academics, not media storytellers, so that, again, for them to learn more about storytelling and how they can use it in their own daily work and life. And I'll finish there.
Thank you, Kate. That was great. Thanks so much. I think you're right. We might need to do a webinar or blog post to get more of those tips in writing and shared with our audience.
Happy to.
So thank you for that. So I think that storytelling bit that you just talked about, these workshops, is a good segue into what we were thinking about here at Health Begins, which is, how can we take these lessons learned from Hollywood and incorporate them into our work? So the question became for us, how can we center individuals with these stories and these lived experiences in our own work? And that's when the inclusion writer came up as a concept for us. For the folks that are on the webinar that are familiar with our work, that we do things like community health detailing, where we bring in community members into the clinical environment. I'm sure we'll have a webinar on that coming up. We also do strategic consulting with clinicians and care teams and executives. And through that work, we bring together person-centered approaches to draw real experiences into health system design. But this inclusion writer concept provided another venue for us to be able to take our core values that we talked about earlier, especially equity, and put it into practice. And so for just background, so an inclusion writer is essentially something that A-list actors can incorporate into their contracts that stipulates an inclusion. And so both on camera and behind the scenes for crew members to make sure that folks are being appropriately reflected in films. The writer can state that women, people of color, people with disabilities, members of the LGBTQ and marginalized communities who are traditionally underrepresented should be depicted in proportion to their representation in the population. And so what we did is we took this concept that A-list actors use, and we have been incorporating it into our own contracts. So for the next few slides, I'm going to go through what the components are of these Hollywood inclusion writers. And I won't go through all of these, but just talk a little bit about how we've been incorporating this. So to start off, there's usually a statement of purpose, which is, why is this clause important to you or your organization? And what we've done is we've used our core values to reinforce our commitment. So what we've done is our statement of purpose relies on, Health Begins has a commitment to equity. And so in doing so, it's important to us that for contracts, for example, for speaking engagements, that members of the panel or anyone, the percentage of people who are presenting throughout the event represent a varied mix of backgrounds. And so this is an opportunity to include facts about representation of certain populations. So for example, if the audience that you'll be speaking in front of have traditionally underrepresented, something Kate and I were talking about were people with disabilities, then this might be your point to be able to say, because of our commitment to equity, we want to see certain representation within that subgroup. The second set are definitions, and this is a standard legal component within any contract you've usually seen, but there is an important definition within that list, which is how are you defining underrepresented groups? And this is something that could be standard throughout all of the contracts that you engage in, or it could be something that you tailor the agreement to depending on the audience that you'll be speaking to. So if you're speaking to an audience maybe of a group of underrepresented minorities based on race, you still have an opportunity to say, well, I want to make sure that there are women that are represented within that group of membership that is based on race, or people that are LGBTQ. So this is an opportunity to tailor the agreement further. The next set is pretty specific to Hollywood, so auditions and interviews and casting objectives. But the way that we've taken this is to think about, well, is it meaningful for your organization to have attempted to recruit, which is what we're talking about when we talk about auditions and interviews. And so if it is important, then you can add that within your inclusion writer. So you can list out, for example, that the organization needed to have approached X number of individuals in an attempt to recruit the underrepresented minorities, as you have defined earlier. You can also set minimum thresholds. This is something that seems pretty standard for how many people you want them to have considered. And then in terms of the hiring objective, it's for us related to the proportion of people who identify as part of the underrepresented minority and are given a platform at the event. So it's not just, how many people did you approach, but how many people did you actually bring on board, and how many people have you given a megaphone to through your platform. The next set is on exceptions. How have you carved out exceptions? And this is something we've thought about a lot, because something that when we've spoken with organizations, especially around speaking events, something that people may say is, we tried to reach out to people of color, or we tried to find LGBTQ individuals and we just couldn't. And so how do you carve out an exception for organizations who just weren't able to meet those hiring objectives that you've set out? And this is where we at HealthBegins have used it as an opportunity to reinvest in pipeline strategies. So, well, in the case that you, as the organizing entity, have not been able to find individuals for your hiring objectives, well, this is an opportunity to invest in pipeline strategies. So you're accepted from this clause if you're then are committed to investing some amount of money into pipeline organizations that are local or national entities that are committed to equity and building the next generation of healthcare professionals within a diverse landscape. The next set of components are regarding reporting, the use of reporting, and compliance. And so this is where Hollywood may have a leg up on us because they have pretty good reporting mechanisms that are built into their inclusion riders. And that might not be possible, especially as we're entering into this field with organizations who might be new to the inclusion rider space. But it's something to think about how do you want the report back on how many people did they contact that represented these underrepresented minority groups. And also, how are you going to make sure that they've been compliant with it? Do you want to ensure anonymity on these reports? I think that's pretty standard if you're going to ask for reporting, that confidentiality and anonymity is given on those reports. But something that we've been thinking about and we're still working through is when does it become too burdensome as we're just beginning to navigate this space to require reporting and compliance metrics for this work. So that was all for the standard components. Dispute resolution is pretty standard across the board, so we didn't get into that. But I wanted to leave some time for questions at the end here. And so I think there was one question that came in that we didn't get a chance to ask yet. So here's a question for you, Kate. So clearly narrative is really important. How can we get the news media in our own local areas to get beyond the statistics and to tell real health equity stories?
Oh, that's such a good question. Yeah. Again, I'm a big proponent of the real people thing, you know, really bringing, whether it's a journalist or an entertainment writer, putting them in contact with real people that are facing these challenges so they can hear their stories, not just hearing the statistics and the data and, you know, X percentage and so forth, but really putting them in a position where they either are immersed in that experience like we've done with, you know, taking people to South Central or wherever, or bringing those people to them so they can really hear their personal stories. Storytelling is really the key, even for news. You know, it's the narrative that hooks us in, and especially if it's a personal story about a real person, a lived experience that we can all relate to, it draws people in and helps them to see what those challenges are better than hearing, you know, this percentage or that. And it's one thing that I counsel even the experts that do come into the writers' rooms for us, and you know, they may be an expert in cancer or, you know, heart disease or whatever it happens to be, or climate change. I tell them, don't start talking statistics. You know, tell these guys about a patient you had that really changed your life, or tell these people about, you know, a study that you did with a group of people and who that group of people were, you know, and anything to tell a story versus science-y, statisticky and wonky.
Yeah, I think we've definitely seen the power of the real person story in terms of shaping ideas and the ways people think. And another question that came in is where someone has tried arguing that they need more diverse speakers in their training events and conferences, and everyone agrees, but then nothing changes. And so these real lived experiences from these diverse members don't get out there on the stage. And so this person's asking how they can break through the inertia, and I can take this one. I think that, you know, this is something that we had to make a commitment to. We've said, you know, well, this is where the buck stops, so we're going to put it in our contracts. And if the organizing entity is not going to be willing to comply with it, then we're not able to perform either.
Right. And, you know, actually that I'll just say something about that as well in terms of Hollywood. Making the case for diverse narratives means having, for us anyway, having representatives of those populations in the writer's room.
Right.
You know, if you have a writer's room that's full of white male writers and you ask them to tell a story about an African American woman, you know, with breast cancer, it's going to be, you know, it's probably going to get shot down, or it's going to be marginalized, and maybe not for nefarious reasons, but other than they just don't have that experience. But if you have a writer's room that has, you know, half African American women and half, you know, or a percentage African American women, percentage African American men, somebody with a disability, you know, and you have a very diverse writer's room, the stories that are going to come out are going to be so much richer and so much more diverse and so much more inclusionary. Is that a word?
Yeah.
So that's part of also what we work to do, is to help writers understand that, you know, to tell stories about women, you might think about having some women in your writer's room. You know?
Right.
And we just did a panel the other night on aging, and it was about telling stories about older people. Well, it would be helpful if you had somebody with some lived experience in your writer's room and not everybody being 25.
Right.
So it's the same sort of thing. I think you're right with the, I forget what you called it, but to get, if they don't have that diversity in their organization, they invest in developing that diversity in some way or another.
That's right. And so I think that your presentation struck a nerve, because we're hearing how, you know, where can folks go to learn more about how to shape a story or a story pitch to get the media's attention. I think that's where you
yeah, well, that's another webinar. We'll have to do
Yeah.
a storytelling workshop, because it's vital. And we do, as I said, we do these workshops with our experts just to give them a taste of what television storytelling and film storytelling is all about, but also to help them tell their own stories better. And it's a lot of fun, and we have a great time doing it. And I would love to be able to help. You can visit our website, and there actually some of our panels are recorded and on our website, so you could get an idea. And I don't know that how much of the storytelling workshops are videoed on there, but you might be able to learn a little bit more about that. And I'd be happy with for anybody who's interested to, they can contact me, and I can put you in touch with some other resources that are out there that might help, you know, in just helping craft your story and craft your narrative, to reach out to the journalists or others in your media community.
Yeah, I think that would be great. And I think maybe that's something we can pull together to follow up with, like, tips and best practices in writing to share with the attendees that joined today. That's great. So I think we're just right about time. So thank you so much, Kate. Thank you, everybody, for joining and for your great questions. As we mentioned earlier, we'll be sending out this recording to all the registrants. And if you would like to chat with us about inclusivity strategies, get connected to Kate, or anything else really, please don't hesitate to contact us. And as soon as we sign off today, a quick survey will pop up on your screen. So if you could take a minute to fill that out, we would appreciate it. Thank you so much.
Okay,
and
thanks.
we hope to see you again on next month's webinar.
Thank you. Bye, everyone.